and welcome to our show, Health and Wellness, Facts versus Myths. I'm Gargi Rawat. Now, nutrition is a critical part of health and development. Nutrition helps us maintain a healthy immune system. Eating a nutritional diet also helps improve our physical and mental health, as healthy eating allows us to have more energy and be more active. Nutrition also helps us prevent and better manage various metabolic disorders. If you have diabetes or heart disease, making the right food choices can help you maintain a healthy weight, control blood sugar and protect your heart. Faced with so many food choices, it's easy to get confused about what you can and can't eat. Even people who've been managing diabetes for a while have questions about the types of diet and the amount of carbohydrates that they should consume. To clear these and other questions and myths surrounding nutrition, we have with us an expert panel to give us the correct information. We're joined by Dr. Sushil Kumar Gupta, Professor Endocrinology, SGPGI, Lucknow, and Dr. Geeta Navudhuri, MD, General Medicine, Gandhi Medical College and Hospital, Sikandrabad. Thank you so much, doctors, for joining us today on the program. First to you, Dr. Gupta, when a person's blood sugar goes up, what does it indicate? Is it measuring what he or she ate the previous day or the current day? And what do the morning blood sugar numbers indicate?
Let me clarify certain things. What is the level of blood sugars actually in a normal human being? Blood glucose is controlled by two factors from the body. We have got insulin secretion and insulin resistance and hepatic glucose output. And when we take food and do exercise, this glucose is these factors determine how much of glucose is going to be there in the blood circulation. In a non-diabetic, there is a balance between the insulin secretion, insulin resistance, and the food and exercise. In a diabetic, the insulin secretion goes down and resistance goes up. And thereafter, when we take food, the blood glucose goes beyond the normal limits actually. In the normal person, the blood glucose level is around up to 100 milligram per deciliter, and after food, it does not goes beyond 140. In a diabetic, it goes high. When we talk of fasting plasma glucose or blood glucose, basically it reflects the increased formation of glucose from the liver, which we call as a hepatic glucose output. When we measure the blood sugar in the evening, it is a reflection of insulin secretion, insulin resistance, and the amount of food and exercise and the amount of exercise you are doing. That's reflected in the evening blood glucose levels.
All right, Dr. Navudhuri, high blood cholesterol levels are a risk factor when it comes to heart disease. So how are blood cholesterol and dietary cholesterol related, and what's the best way to reduce the amount of cholesterol in one's diet?
Yeah, the blood cholesterol levels and the dietary cholesterol levels are directly related, because the more amount of saturated or trans fats in our diet will increase our blood cholesterol levels. So saturated fats and trans fats are high in food items like red meat or full fat dairy products, or foods containing hydrogenated vegetable oils like cakes, cookies. So these are the diets which will cause increase in our bad cholesterol, what we call as the LDL cholesterol. So in place of that, if we go for diets rich in omega-3 fatty acids like salmon, cod liver oil, those will increase our HDL levels, that is a good cholesterol, and increase diets rich in soluble fiber, which will also help in reduction of absorption of cholesterol in the diet. So when we purchase food items in the market, we can actually check them on the labels. High saturated diets are given as a red label, and diets less in these trans fats and saturated fats, it is given as a green label. So when you go for foods which are lesser in trans fats or saturated fats, we can avoid consumption of those fats and try to include more of omega-3 fatty acid rich diets, and go for a regular exercise. Quit smoking, quit alcohol, even because those two, alcohol and smoking, also can increase our cholesterol levels. So directly, our diet habits will directly affect our total cholesterol levels.
All right, so that's how to reduce your cholesterol and through your diet. Dr. Gupta, carbohydrates are also an important part of diet, but people with diabetes have to be very cautious about the amount of carbohydrates that they intake. How much a carbohydrate per meal or day would be good for a person with diabetes?
Yeah, our diet basically contains of macronutrients, which are carbohydrate, protein, and fat, and certain micronutrients actually. All are important in a diabetic person. Normal diet, Indian person who consumes the Indian diet, is the carbohydrate content is around 60 to 65%, with low amount of protein, and fat is around 20 to 25%. In diabetics, we reduce the amount of carbohydrate to around 50 to 55%. Now, why to reduce this thing? Because the insulin is required to consume the glucose released by the carbohydrates. There are two types of carbohydrates. One are simple carbohydrates, which release the glucose level in a very rapid way, actually, and they are not recommended. We recommend complex carbohydrates, which are digested slowly. They release the glucose from in the intestine very slowly, and that therefore the rate of increase in the glucose levels in the blood is slower, actually. So all the diabetics are recommended complex carbohydrates in the proportion of 50 to 55% of total daily calories intake. Fat and protein are equally important. We advocate protein intake of 1.8 to 1 gram per kg body weight, and fat less than 30% total daily calorie intake. Now, distribution of carbohydrate is equally important, actually. We distribute the carbohydrate to the tune of 40%, 25%, and 25% across the three meals. So we normally generally distribute equal among all the meals. That's the most important thing which we need to emphasize to the person to control the diabetes in a proper way, actually.
Right. Dr. Navudhuri, we've read in many articles that dark chocolate and red wine are good for the heart. Is this true, and just how much is considered healthy?
Yeah, dark chocolate and red wine, there are many studies and articles showing that it is good for a healthy heart, but there are limitations for it. Red wine and dark chocolate contain antioxidants which and flavonols, which are actually very good for the heart. But the red wine consumption, it is limited. There's a limitation for that. Amount of in men, it required amount is around 2 drinks per day. And for women, it is 1 drink per day, and for men aged above 65 years also, it is 1 drink per day. 1 drink amounts to it is equal to amount of around 148 ml. So that is the amount which has to be consumed. You cannot take it in large quantities. Large quantities are always bad for the health. So those who are already having an habit of drinking, we recommend a moderation of the moderate amounts to be taken, and we don't recommend those who don't have the habit to take alcohol for a good heart. And similarly, chocolate also, it's a dark chocolate in its purest form, is which has got cocoa content higher, is the one which has got the antioxidants. It is good for health, but not the synthetic dark chocolate what we get in the markets, where there is more amount of sugar and carbohydrates and fat in that. So if we can get the purest form of dark chocolate, it may not be very tasty or palatable, but that which contains cocoa is the one which has got the real antioxidants, and that is the one which is good for the heart.
All right. Now, Dr. Gupta, what is a glycemic index? Does a person with diabetes then need to eat only low GI foods at every meal to see a benefit?
It is a very important aspect you have asked, actually. Whenever you take any food, it is digested to glucose, and glucose is absorbed in the intestine and it goes to the blood. So when we take any food, the carbohydrate is digested and there is increase in the glucose levels. Faster the digestion and absorption of this food material, the higher the glucose would be. So glycemic index is basically ability of any food to increase the blood glucose levels in next 2 to 3 hours. So basically it is the area under the curve which we measure and divide the various foods, the low glycemic index foods and high glycemic index food. So high glycemic index foods are those who have got faster absorption of glucose in the intestine, while low glycemic index have a slower absorption of glucose in the intestine, and therefore they are better for managing diabetes, in fact. Now, if we talk of low glycemic index food, they are the coarse cereals like jowar, bajra, maize, ragi, millet, various legumes, green vegetables, leafy vegetables, protein and fat. Basically, these are the low glycemic index food. When we talk of carbohydrate, protein and fat are not there, but these coarse grains, legumes and green vegetables are good food with a low glycemic index. So while controlling diabetes, one should consume the low glycemic index food because it makes the glucose levels to rise slower, and it is better to maintain the blood glucose levels with a smaller amount of drugs or insulin in a better way, so that your A1C remains within normal range, your blood glucose remains within a normal range.
All right, Dr. Navudhuri, is it true that foods rich in both soluble and insoluble fiber help to reduce the risks of cardiovascular disease and coronary heart disease?
It is actually the soluble fiber diet which helps in protection against the cardiovascular diseases, because it's a soluble fiber which prevents the absorption of cholesterol into the blood. So it prevents the absorption, it decreases the cholesterol levels. So diets rich in soluble fibers are diets like oatmeal, kidney beans, sprouts. Then we have the apple, pears. These diets will decrease the cholesterol absorption into the blood. It can, to some extent, even decrease the absorption of glucose into the blood and therefore maintain the glucose levels also. Whereas we come to so the minimum required amount is around 35 grams per day for men, and for females it is around 25 grams per day. And we come to the insoluble fiber. The insoluble fiber will add bulk to the food and it will help in the easy elimination of the waste products. So insoluble food mainly is concerned with in treatment of constipation. So it helps in the maintenance normal gut mobilization. So it is the soluble fiber which helps in the decrease of the cholesterol levels and maintenance of good health and for cardiovascular benefits. Insoluble fiber helps in maintaining the gut health and prevention of constipation. So insoluble fiber you can find in foods like whole grains, then wheat bran, then pineapple, grapes, potato. These are the diets which are rich in insoluble fiber. Both soluble and insoluble fiber are required for a good health.
All right. Well, thank you so much, doctors. We'll slip into a short break. We're talking about nutritious and how to manage your intake during diabetes and also for your heart health. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Well, let's now go across to our panel of doctors to talk about having a nutritious diet. And Dr. Gupta, there are some articles on the internet that state that certain foods can reduce blood sugar quickly. Do such food items exist, or is this just, one of those myths?
Basically, it's not a reality nor a myth, is in between actually. So we are referring to the food with a low glycemic index in this situation. As I said earlier, the low glycemic index foods increase the blood glucose slowly. And these are the foods who are the coarse cereals with the high amount of fibers actually. So fiber reduces the absorption of glucose into the intestine, and therefore the rise in the blood glucose levels is much, much slower. So when we talk about low glycemic index, the coarse cereals, legumes, green vegetables are recommended. One should avoid potatoes or sweet potatoes. They're not absolutely off, but they should be taken very moderation in amount. One should avoid free sugars. One can take sweetness for that, because free sugars are having a very high glycemic index and rapidly increase the blood glucose levels. So other green vegetables like spinach and other things, they are usually recommended because the high fiber content. Cauliflower, broccoli, they have got high fiber contents and therefore recommended. So when we talk of these kind of food which reduce the blood glucose levels, we are usually referring to the food which has got a low glycemic index.
Right. Now, Dr. Geeta, what is the role of cardiac rehabilitation after a cardiac procedure? If you're going to talk about this, tell us what it is, and is home-based cardiac rehabilitation then possible? And what is the role of diet in this?
Yeah. Cardiac rehabilitation, when we are talking about, there are two phases in that. One is the inpatient cardiac rehabilitation, which is taken care by the hospital staff. But the main and more important part is the second phase, which is after the patient is discharged and sent home. So the major things which are to be considered in cardiac rehabilitation at home are: one is diet, then proper medication, and minimum amount of exercise, and avoiding any mental stress. So when we come to diet, again, we advise, if a patient is hypertensive, we have to check for the baseline values. If he's hypertensive, then go for a low salt diet. If diabetic, go for a diabetic diet. Check for the lipid profile. If the profile of the cholesterol levels are high, then we avoid saturated and trans fat diets. Then if you are going for exercise, so minimum amount of exercise at home. We don't advise very strenuous exercises for a cardiac rehabilitation. Basically, exercise stress test is done to see how much amount of exercise the patient can do. Then accordingly, we advise a minimum amount of exercise. And then if any habits like alcohol or intake or smoking is there, then quit alcohol, quit smoking. And then for mental health, see that the patient doesn't have any mental stress, so even psychological support is needed from the family also. So all these components like diet, exercise, and then proper medication. If any medication is needed for hypertension or diabetes, give them the proper medication on proper time. And then if any cholesterol is very high, along with diet, we even recommend even anti-cholesterol drugs. So all these done in properly in on time is the way of doing a cardiac rehabilitation at home. So diet, exercise, once again I stress on diet, which is a major thing, and then diet, exercise, minimum exercise, then medication on time, quit smoking, quit alcohol.
All right. Now, Dr. Gupta, if a person manages to control his or her blood sugar well, then does that person get leverage to eat whatever she wants, cheat one of those days? If you could tell us about that.
Very interesting question, actually. Everybody thinks that blood sugars are controlled, they can eat whatever they want, actually. Basically, diabetic diet is basically a food in moderation. The amount of calories determined on the basis of body weight, physical activity, and other factors. So, one diabetic person is prescribed a certain amount of calories, which comprises of carbohydrate, which is around 50 to 55%, fat less than 30% total calories, and protein 0.8 grams per kg body weight, along with the fiber around 35 grams per day. Now, this food needs to be distributed across the whole day in the 3 equal meals. So, our blood glucose control is basically managed by maintaining a proper diet and regular exercise along with the drugs. So, one can do the cheating, but that's not required actually. But you can take the food in moderation and adjust the amount of drugs, especially the insulin, if you're taking according to that. So it is not ad libitum that you can consume any amount of it in any other meal. One should take these foods in moderation as per the individual components of the food.
All right. And Dr. Geeta, what's happened over this COVID pandemic is people have started taking a lot of supplements, especially to improve immunity. So do you recommend taking vitamin supplements, or do you think all vitamins should come from our food?
Yeah, as a physician, I would recommend to take multivitamin supplements, because nowadays the kind of foods which we get, all the synthetic foods or processed foods, will not give you all the vitamins which we require for a body, especially the trace elements like copper, zinc, selenium. We may not be getting in our diet. So even those trace elements are also very important for our good health. So, and moreover, in this pandemic, we have almost recommended for all patients to take multivitamins even after recovery for months. So, as a physician, from my practical point of view, I would advise to take multivitamin. But it doesn't mean that taking a multivitamin tablet, we will not take any healthy food. See, along with the vitamins, a proper diet is always a must, and a diet rich in fresh fruits and vegetables, then avoiding saturated fats or trans fats. These are the major things along with multivitamins. But as a physician, I would recommend vitamins in the diet along with the diet. And major thing is
all right. Well, Dr. Gupta, anything you'd like to add to that? And do people with diabetes need to take any extra care when it comes to supplements and vitamins?
One should take supplements in diabetic. Primarily, one should maintain his blood glucose levels in the normal range. In diabetics, we keep fasting plasma glucose levels between 80 to 130, and 2 hours after meal, we keep it around 140 to 180. In recent times, there is one concept which is known as time in range, that between 70 to 180, your blood glucose level should be at least 70% of the whole day of the time, whole time of the day actually. So, and one should maintain A1C less than 7%. This is very, very important to maintain the A1C less than 7% for whole life actually, because this is going to reduce the long-term complications of diabetes, because diabetes affects your heart, kidney, your retina, eyes, and all other organs are involved in this. So one has to maintain blood glucose levels within normal range as long as possible for a longest duration of period. Use balanced diet, equally proportions as recommended dietitian. Do regular exercise, avoid smoking, take alcohol in moderation, and do yoga and meditation to reduce the stress level. Periodically screening for the complications for diabetes is extremely important because all these complications can be prevented, can be treated in early stage. Because in end stage, nothing much can be done except replacement therapy actually. So living with diabetes is not difficult. One has to maintain a healthy lifestyle, a disciplined lifestyle, do regular exercise, take food in moderation, take drugs, and consult your doctor on a periodic basis. That's the most important point I would like to make.
All right. Well, thank you so much, doctors, for joining us and speaking about this very important issue of nutrition in our diet. And thank you all for watching at home. Goodbye.